But one of the things to say as an overall framework for all of this guidance is that we have really been working off of various different phases of the pandemic and the responses. So moving from kind of an early phase that Maryland was in for a very brief period of time back in the beginning of March, where essentially there was low population community spread and prevalence of the novel coronavirus, and where things like containment strategies, isolation, and contact tracing in particular was really kind of the goal and the idea to then help prevent viral transmission. We have quickly moved into this middle phase where higher population prevalence really makes those kinds of containment strategies just impractical. And while we still need to be practicing physical distancing and universal face masks and some of the other like screening protocols, for example, that were begun in the early phase, we really now are moving towards thinking about designating entire areas or systems that may need to be established based on larger populations of infectious or non-infectious persons. And that to some extent, with large community spread and a virus that may actually, people may be infected even though they're asymptomatic, they're really kind of assuming infectiousness is something that, that we may need to be at a point where we're thinking about that. So in the later phases, and then kind of it's a third phase to even then post-pandemic, that making sure that we are continuing these mitigation strategies, aggressive measures, as recovery kind of slowly begins, and that understanding that we may need to go back to some of the prior phases because they may repeat. So a couple of points on some of the guidance that we have available. So the first and one of the keys that Nishan also mentioned and that we'll hear more about is telehealth access for addiction treatment. So the guidance really talks about what to think about when implementing telehealth, the technology considerations. How are you going to be communicating with patients? Do they have cameras or is it phone only? How do you document actually kind of what is now a not in-person visit? What are some of the workflows that you need to think about? Maryland was very lucky that we quickly were able to, through the governor's executive order, be able to get paid for phone only and other types of telehealth medicine. On the website, there also are links to valuable other resources and a whole list of some of the state and national level regulations really governing telehealth access. There's another section that people might find interesting around online support groups, not only where and how to find them, but also guidance for maintaining confidentiality, for example, and really thinking about how do you maintain the security of whatever platform it is that you're using.